Hello everyone, it's Michael Phillip, your physical therapist, and today's topic is meniscus tears. Your meniscus is a soft, cartilage-like structure in your knee that provides improved stability and helps to disperse weight in the knee. They are crescent-shaped, and each knee contains a medial and lateral meniscus that fit the ends of the long femur bone in your thigh. You commonly hear them, unfortunately, when people tear them. Tearing can occur over a period of time from normal wear and tear, or can happen acutely, most commonly with a twisting motion while the foot is in a planted position during a lifting or sporting activity. Symptoms are usually pain, swelling, and difficulty putting weight on the affected leg. Common complaints following a tear are pain with bending, going up or more commonly downstairs, and performing any twisting motions. You will typically initially have pain and swelling for 1 to 2 weeks. After that, a locking feeling or difficulty returning to sports or squatting may persist for much longer. The healing time and treatment for a torn meniscus depends on the size, location, and the symptoms. Outside 1/3 of the meniscus has a rich blood supply, so a tear in this area may heal on its own or can often be repaired with surgery. However, the inner 2/3 do not have a rich blood supply, therefore cannot receive the nutrients required for healing, so it cannot heal or has a very difficult time healing. If a tear occurs here, I commonly describe it as a hangnail that just won't go away. At times it can be flat and it can be non-irritated, but you make the wrong move, it sticks up to the knee joint, causing irritation, swelling, and a feeling of locking. This type of tear is commonly trimmed away with a simple outpatient surgical procedure similar to clipping away that irritating hangnail. Recovery is often quick, but physical therapy is often needed from 1 to 3 months following the surgery. The other option is to surgically repair the meniscus. In this case, the surgeon actually stitches together the torn edges of the meniscus. This recovery typically takes longer, as you may not be able to place weight on the knee for 2 to 4 weeks actually following the healing. Physical therapy is almost always needed following the surgery to improve your range of motion, strength, and gait pattern. With a surgical repair, physical therapy will typically be prescribed for 3 to 6 months. In either case, a full return to physical activity is normal. To get your knee pain diagnosed, or if you suspect a knee tear, you should always visit your doctor or physical therapist. He or she can typically diagnose a suspected tear by taking a detailed history and performing special movement tests. Then, if the tear is suspected, following this, physical therapy may be prescribed to see if it can heal on its own, or you may be sent for an MRI to get an image of the exact location and extent of the tear. Then you and your doctor can then determine what the next steps will be. So that is the basics of meniscus tears. Stay tuned for other videos on knee pain and prevention. Till next time.